Hi everyone, thanks for coming back. The thing for this video vlog is to do with old people or elderly generations, you know, and how they feel pain and how they don't actually show they're in pain. And it can be quite difficult to ascertain if they are in pain or not for real, or if they're just hiding it. We had a gentleman last night. This is why I'm a bit sort of a bit peaky this morning, because we had a very late night and I finished quite early in the morning. So we got called out to a fall-on non-injury initially. So this person apparently was on the floor and then had got up. So then it turned into a lower urgent call, as it were. So my colleague and I went up to the house and got let in. We saw this gentleman sort of leaning on a chair, or sitting on a chair, and he looked, he looked okay. Very hard of hearing, the typical sort of elderly person who's not as fit as they would have been a couple of years ago, and is managing well. Yeah. And the story is that they fell on the floor, trying to I think get hold of their walker. They landed on their side. They were then able to get themselves up after a time, like a few minutes or something, and then walked to the bathroom, walked to the kitchen, and then sat back down into the chair again with a bit of discomfort. When we initially looked at them, we thought, okay, so seems to be okay. And then you see the sort of telltale signs across their eyebrows, a little bit of a discomfort, a bit quieter than usual. You need to talk to your you need to talk to the family members, because also they know how that patient is normally. And as we were getting to move his feet, the grimacing got worse. So of course the pain was getting worse. It turned out he had actually fractured his hip, and we found this out by just doing an assessment of his hips, his legs. His foot was a discoloration as well, different things like that. Eventually got him onto the stretcher, and you can see that a classical sign of NOF or neck of femur fracture is that the legs, one leg shortens, and then you have a rotation on the foot towards inwards or outwards, but mostly inwards. No, outwards. Sorry, I told you I'm a bit tired today. And then the pain started coming back a bit more. So I'm glad that we did the assessment, because initially we were going to think, okay, he's a little bit of pain, because he had some problems with the hips originally anyway, but it didn't seem to characterise the normal way of having a NOF. But he was very stoic in the way of actually showing his pain. He kept it inside. So be very, very aware that elderly people sometimes don't show pain, sometimes can't feel as much pain as a younger person does, purely because of, as you get older, the receptors of pain lessens and dampens, yeah, so you just make sure that when you have picked someone up from the ground, and you do a C-spine and a top to toe, that there really is no pain around the hip side, because there could be a silent NOF there. And yeah, I checked on him today, and yeah, he had actually fractured his ball and socket point on his hip. So that was a good call. All right. Anyway, that's it for today. I will come back to you soon, and with another story and some more information about ECAs. Take care. Bye bye.